Diabetes, termed diabetes mellitus, is a disease that has been around for thousands of years. It would present when people under the age of 20 developed unrelenting thirst and hunger, followed by urinating profusely. People would develop these symptoms and soon die. This was known as type 1 diabetes. Then there was type 2 diabetes, which was more gradual in nature and usually affected people over the age of 45. Before the 1920s, there weren't any treatments for diabetes available. Then, in 1921, Dr. Frederick Banting was able to isolate a substance from the pancreas of dogs that saved the lives of millions of people with diabetes. This substance was insulin. Today, there are numerous insulin formulations for treating type 1 and drugs available to treat type 2 diabetes. Although diabetes isn't curable at this point, it is considered a chronic disease and is certainly treatable. Today, the term diabetes mellitus is recognized as a group of metabolic disorders which result from impaired insulin production and/or high blood sugar levels. It's broken down into two main types. When the body has lost its insulin secreting capacity, this is called type 1. When the body secretes less insulin than is needed and doesn't respond to insulin properly, which is called insulin resistance, this is called type 2. Type 2 diabetes is a condition where either the pancreas does not produce enough insulin or the body cannot use the insulin properly, known as insulin resistance. When there isn't enough insulin or the insulin is not being used properly, glucose, sugar, can't get into the cells of your body. When glucose builds up in the bloodstream instead of going into cells, the body's cells are not able to function properly. This results in elevated blood sugar levels above the normal ranges. In a normal situation, your blood sugar level should never go above a certain point, because if insulin is doing its job properly, the blood sugar is mopped up from your bloodstream. The problem with high blood sugar in your bloodstream is that if left uncontrolled and blood sugar levels remain high over a period of time, this can lead to serious complications. The reason for this is because high blood sugar levels can be toxic to your organs and lead to damage. If you want to learn more about type 2 diabetes, you need to check out my Master Your Diabetes program. If you're newly diagnosed or have had type 2 diabetes for decades, the higher your diabetes IQ, the better chance you have of conquering diabetes. To master your diabetes, visit masteryourdiabetes.com now. Prior to using any of this material, please consult with your physician.